Okay, good evening, you guys. It's Dr. Amir Vokshar and Dr. Jared Ament.
Dr.
We're
Jerry.
going to try to talk about a few pertinent things that have to do with artificial disc replacements in the spine, one of the hottest, newest technologies that we have available for us. The pandemic has given us an opportunity to concentrate on more education of our patients, and we hope that this is useful.
Absolutely, yeah. And as my partner, Dr. Vokshar, mentioned, one of the things that we've talked about recently that we wanted to bring to everyone's attention was, when to use the right artificial disc in which patient. I mean, I call you all the time and I say, what do you think? And it's a really interesting question because I'm not sure anyone knows the answer. But we just had a case together recently where there was some laxity, meaning that the spine was a little bit more mobile than one would like in the setting of an artificial disc. And there was a discussion of like, do you consider a disc that is more quote unquote physiologic, more constrained, meaning that there's less, motion, natural motion in the mechanism of the disc versus a disc that you're, more familiar with or is more popular or on the market or, who knows? And should we consider artificial disc in any segment that has any motion? Is that something we should even be thinking about?
Fantastic question. And I think, if you go down the exact strict indications, as spine gets more arthritic, it's more difficult to replace the disc and expect perfect kinematics. So stiffness of the segment can be inherent or it can be due to secondary things like facet arthropathy. So I think it just depends on whether the hypermobility of that segment is coming from an inherent source or an arthritic source or pathologic source.
I mean, that's an interesting point because we actually had this discussion, and in this particular patient example, there was no arthritic source. This was kind of inherent, patient's normal ligamentous laxity.
Exactly.
And the actual facet joints and looking at the posterior elements looked fine.
Spine is the newest kid on the block as far as being able to do arthroplasty. That means replacing a motion segment with a mobile device. And I think we're going through the adolescence of disc replacement because we started with Charité, which was way too hypermobile, and it failed miserably. We got to ProDisc and Mobi-C, which were quite exciting. But our patients ask that all the time, right? They're like, what do you think of ProDisc? What do you think of Mobi-C? Because they've heard it somewhere, they've been marketed to some way. And it's our job to look at each individual motion segment and say the kinematics of this artificial disc fits best with this patient's problem.
But I think the takeaway from this discussion is that there isn't a one size fits all. And I think even when we discuss this in the patients, even though my experience has been more with Mobi-C, a lot of the surgical nuances are very similar. The exposure is very similar. You can learn about the new discs, but I think it behooves all of us as surgeons to really learn that, to learn the kinematics, look at that data, understand how constrained, how mobile these discs are on multiple dimensions, not just flexion extension, but rotation, lateral bending, all of those things, and really understand it. Because I do think when you say it's in the adolescence, I couldn't agree more. And it's because those details are more nuanced than just, I've used this disc for a couple of years, I really like it, and patients do well. Most patients do well. But when we start looking at things like, there's a little bit of a hyperlaxity in a segment, maybe that patient won't do as well as you'd expect, depending on the disc you choose. And I think that's something we need to keep looking at and really talking about.
I love that take-home message. The individuality of each spinal motion segment needs to be considered, and the kinematics of each disc need to match that motion segment the best to restore physiologic motion.
Yeah, couldn't agree more. Well, this last patient's doing great. So
wonderful. Let's keep it going.
Absolutely.